Hello, welcome to part 3 of my series on a better understanding of respiratory therapy for healthcare workers and nurses. In the first part, I talked about the different ways of classifying respiratory disease, lung disease. And in the second part, I talked about oxygen. And now I want to expand a little bit more on the normal physiology that has to take place and in order for gas exchange to occur. And I'll be talking more about oxygen. And what I've shown you here is one alveoli and one capillary bed, because if you can understand simplistically what is happening with one alveoli and the perfusion past it, then you can apply that globally to all of the lung fields. So this is one alveoli, and this is one capillary that is going past that alveoli. And what I've shown you here is that there is some interstitial space between the two. Not much, but there is space between those two. And for respiration to work, what we have to talk about is the ability of getting oxygen from the atmosphere all the way down to the alveoli, and then from there to get into the bloodstream so the bloodstream can take it to the rest of the body. So as I'm standing here, and as you're sitting there, and you take a breath, you're contracting your diaphragm muscles, that is allowing atmospheric air to flow into your lungs. And what we want the oxygen to do is get all the way here into the alveoli. Disease happens if there's a disruption in the ability of getting oxygen to the alveoli, or from the alveoli it has to diffuse through the alveolar wall. From the alveolar wall, it has to get through that interstitial space, and then it has to diffuse through the capillary wall to get into the bloodstream. While it's in the bloodstream, it has to diffuse through the red blood cell, and from the red blood cell, it has to hitch a ride on the hemoglobin molecule. If you think about it, that's a long way for oxygen to be able to get to where it needs to go. Any disruption in this system is going to cause a problem with oxygenation and CO2 clearance. And the other thing that you have to remember is that while this is going on, blood is not static. It's dynamic, which means blood is flowing. So as blood is flowing by, oxygen is having to get through into the alveoli, through the alveolar wall, through the interstitial space, through the capillary wall, into the plasma, and from there it has to hitch a ride onto a red blood cell and the hemoglobin molecule specifically. And while that is happening, CO2 is going in the opposite direction. Now if you think about this more for just a minute, I think what you'll agree is that if we have a disruption with our pulmonary system, let's say that there's damage to the alveolar wall. Let's say that they have a pneumonia. Maybe the alveoli is collapsed, they have atelectasis. Maybe that they have some sort of inflammation and swelling of this alveolar wall. I think you would agree that it might make it more difficult for oxygen to diffuse through that alveolar wall. Or maybe there's nothing wrong with the alveoli, but maybe they've got interstitial edema. So you put more fluid in this interstitial space, and maybe there's debris and particles that are going to disrupt the ability of oxygen from getting here through the alveolar wall, through that interstitial space. Or maybe they've got inflammation or thickening or hardening of the arterial wall, the capillary wall, the venous wall, and it's going to make it more difficult again for oxygen to get into the hemoglobin. This is assuming that the patient doesn't have any anemia. This is assuming that the patient has an adequate amount of red blood cells and hemoglobin, because remember, oxygen has to have carrying capacity. It carries oxygen, it carries CO2. In the pulmonary system, the hemoglobin has to offload CO2 in order to make space to onload oxygen. And this entire system is reversed at the tissue bed, because there oxygen has to offload to the tissue bed to be able to help with metabolism, while CO2, which is a waste product, has to offload from the tissue and get back into the hemoglobin so it can return to the alveolar structure so that we can have that gas exchange. If you disrupt anything in this system right here, you are going to have a patient that has acute hypoxemia. Hypoxemia is a low level of oxygen in the blood. Hypoxia happens at the tissue level. If you can't get oxygen onto the hemoglobin to get to the tissue bed, that will induce tissue hypoxia. All of this is a function of aerobic metabolism. Metabolism that takes place because oxygen is present. If you don't have oxygen present, cellular function and metabolism can still take place, but it's not as efficient, and that's called anaerobic metabolism. Metabolism that takes place without the presence of oxygen. Now sometimes, maybe you're assessing a patient and we think that they have tissue hypoxia, maybe they're hypoxemic. Oftentimes the very first thing that we want to do is we want to increase the amount of oxygen that is being supplied to the patient. If we do that, let's say we put them on a nasal cannula, a couple of liters per minute, what that's doing is that's increasing the partial pressure of the oxygen in the alveoli. By increasing the partial pressure, that enhances diffusion. Remember the example that I gave you if you opened up a perfume bottle. So if oxygen is in a higher concentration in the alveoli, that will assist oxygen diffusing through the semipermeable membrane, which is made up of the alveolar wall, the interstitial space, that capillary wall, and it will aid in treating hypoxemia. That's just one thing that we have to focus on. In further courses that we're going to do, I'm going to talk more and more about this alveolar-capillary wall structure and other treatment modalities that we can use to enhance the ability of oxygen to get into the bloodstream, to get onto the hemoglobin, and to be able to transport to the tissue level while offloading CO2. At any point through any of these lectures, if you have any questions, please feel free to leave a comment, and I review those frequently, and I can answer any of your questions that you have for you. Thank you very much.